Hello. Today I'm going to talk about a new therapy that has been used to treat metastatic colorectal cancer, MCRC. First, a few words about why this treatment is needed. Let's take a closer look at a solid tumour. In solid tumours, cancer growth and progression involves multiple pathways and cells, as well as interactions within the tumour microenvironment. In CRC, the formation of new blood vessels is critical for tumour progression and for local invasion and metastasis. Endothelial cells form tumour-associated blood vessels and play a key role within the tumour microenvironment. Tumorigenesis is responsible for the proliferation and survival of malignant tumour cells. Interactions and signalling within the tumour microenvironment also contribute to tumour growth and stabilisation. In MCRC, multiple ligands, receptors and kinases are overexpressed, as well as activating mutations in several cytoplasmic downstream signalling pathways, such as RAS, RAF, MEK, ERK, and PI3K, AKT, mTOR. Driver mutations that cause kinases to be constitutively active are associated with most cancers. However, tumours can escape from the inhibition of any single kinase through mutation of the target or by the presence of activating mutations in downstream pathway kinases, such as KRAS or BRAF, resulting in disease progression. Now it's time to talk about a new treatment. It's called Stivarga, and the active ingredient is regorafenib. Let's look at the mechanism of action. Targeted agents which inhibit multiple pathways of tumour growth and progression have emerged as a new direction for the treatment of solid tumours. Firstly, as you can see, Stivarga is in tablet form and is conveniently administered orally once daily. But let's take a closer look at the molecule. As you can see, once metabolized, Stivarga also has two active metabolites, M2 and M5, which have been shown to be active in vitro and in vivo models. But of course, what's most important is how Stivarga works within the body. And here's where it gets really interesting. When we examine how Stivarga acted in preclinical studies. Stivarga blocks the protein kinases VEGFR1, 2, 3 and Tie2, involved in tumour angiogenesis, inhibiting the growth of new blood vessels. This drug also inhibits the oncogenic protein kinases KIT, RET and RAF1, BRAF and mutated BRAF V600E, involved in the proliferation and survival of malignant cancer cells. In addition, Stivarga has effects on PDGFR and FGFR, which are also involved in the tumour microenvironment. In clinical studies, Stivarga has been shown to significantly increase overall survival in MCRC patients who have progressed on standard therapies. Your patient can take Stivarga at home once a day for 3 weeks and then a week without treatment. Convenient for your patient, unique in its mode of action, it represents an entirely new way to treat MCRC.